End the time, because I'm not coming back for this.
U.S. health officials today said 971 measles cases have been reported already this year. That's the most in 27 years. That breaks the previous record, which was 25 years ago, and we're pushing 1,000 cases now. Most of the cases have been in New York City. Nearly 3/4 of the cases have been in New York City. So in many ways, this is the story of one large outbreak that's kept going. I talked to New York City's health commissioner today, and she said she's optimistic, cautiously optimistic, that the epidemic, the outbreak in New York City is starting to subside a little bit. They have 400 people in the city health department working on this. They've been trying to do more work in the ultra-Orthodox community where the outbreak has been centered in Brooklyn. Yeah, there's been a highly effective vaccine that's been available for decades, and U.S. vaccination rates have gone up to pretty high levels, but there are communities, there are pockets within the United States where vaccination rates are low, and one of them has been some communities, some neighborhoods in Brooklyn. And yeah, there have been concentrated efforts by people who have questions about vaccines or described as anti-vaccine people who have tried to convince parents not to get their children vaccinated, and that's been the root of these outbreaks. Well, a question that's popped up is, how far is this going to go? Are we going to reach the levels that were seen in the early 1990s when there were more than 20,000 cases a year? The answer to that question is not clear. Some of the experts I talked to said it's not likely because circumstances were different back then. The vaccination recommendations were changed since then. A lot of poor kids had trouble getting access to vaccines, and there's been a federal program since then that make it easier for low-income families to get their children vaccinated. All that's changed, so there's optimism that measles levels won't reach how high they used to be.
Oh, you're fine. He's okay. I'll just